and we've been pushed around, we've been bullied, we've been fined, but we've stayed strong and we keep standing together. This government is still expecting us to cope with months of cupcakes, pizza, massages, all lip service when we still can't get proper staffing, proper breaks, proper resources, all while our patients go without proper care.
There is evidence in Victoria and Queensland that safe staffing really, really works. Why can't we do it here? We are a so-called premier state, but honestly, our healthcare system is absolutely appalling.
We're not able to provide safe patient care because you're physically not able to attend to all of the patients because we're too thinly stretched.
I'm just sick of being put in a situation where I feel like my patients are at such high risk that they could die.
I'm sick of having to prioritise who gets the care and what sort of care they get. It's crushing my soul, and to be honest, I don't know how much longer I can keep doing this.
We're hemorrhaging staff while this government runs around unveiling new buildings. New South Wales is now the second worst paid state in the country.
And we deserve to be paid for the work that we do. We are a profession and we have worked damn hard to get here, so pay us accordingly.
You worked hard to keep us safe and get us through a crisis, and this government has walked away and turned its back on you all.
Every day they refuse to fix the staffing crisis is another day risking patient safety. Our campaign to date has won concessions from the Greens, has won concessions from the Labor Party, and as we just heard, nothing from Mr. Perrottet.
The state's nurses are now as mad as hell,
demanding mandated staff-to-patient ratios and better pay.
A show of solidarity at hospitals across the state, from Tweed Heads and Tamworth to Coffs Harbour and Gosford. The target of their frustration is clear.
What do we want? Ratios! When do we want them? Now!
Our smaller hospitals are collapsing under the pressure. Staff shortages are causing them to close their emergency department at a moment's notice.
Throughout the last 12 months, we've been in some service failure where we've had to close down our ED.
And the more regional, the more dire staffing levels become.
I'm doing the work of two people. My job does not need to be nearly as stressful as it is. My job doesn't need to be nearly as overwhelming as it is.
It's time that rural health gets a better deal. Our Rural Health Minister is very happy to come down to our hospital and get their photo taken for the brand new ED and soon to be open maternity units that have been built, but they can't provide staff to staff these places.
We are told that mental health care is a priority. If we are really to prioritise mental health, then we need ratios in mental health nursing. No area can be left behind in our fight for safe staffing ratios across our public health system.
We don't have enough midwives to look after the amount of babies and mothers that we have that need higher care these days. Some midwives per shift can look up to 10 mums and 10 babies. It's unfair.
Trying to keep women safe and babies safe. So the fact that we don't have ratios leaves us vulnerable, and that's the bottom line.
How can this job I love so much hurt me? How can fighting for my patients be this difficult? How can being a nurse make me feel so sick that I don't want to do it anymore?
Perrottet, we are not going away. Your arrogance is costing lives.
It's time for this government to step up and deliver ratios and a decent pay.
We need to continue to remind our politicians that we are too big, too loud, and too angry to be ignored.
By speaking up and taking part in collective actions like this, you've generated the pressure needed to force politicians to do better, and some of them are. So let this be a message to the current government: get on board or get the hell out.